Good afternoon, everyone. Welcome to NEET PG Live Daily. Myself, Dr. Apoorva Mittal, and today we'll discuss about massive blood transfusion. Okay, yesterday we discussed about the complications related to the blood transfusion, but today we'll discuss per se about what is massive blood transfusion, what are the protocols to start with the massive blood transfusion, when to start with massive blood transfusion, and what are the complications which are associated per se because of the massive blood transfusion. Okay, so welcome to NEET PG Live Daily and welcome to Unacademy friends. Unacademy is India's leading platform for online courses. Okay, and by getting the Unacademy Plus subscription, I'm sorry, just give me a second. There's some problem with my this. Okay, and by getting the Unacademy Plus subscription, you will be able to avail the live classes and also interact with the educator for all the 19 subjects. Also, we will be having daily test series and analysis through which you can evaluate the progress and also know what type of questions will be asked. And also, we will be having live doubt clearing sessions through which you can clear the doubt pertaining to that subject. Okay, so these are the advantages of the Unacademy Plus subscription, which you can get from 12 months or 24 months. And if you apply my code Apoorva Live, you can get 10% discount on the same. So starting with today's topic, that is massive blood transfusion. So as I told you, we'll first discuss why or in which conditions we will give the massive blood transfusion. What is actually massive blood transfusion? What is the definition of the massive blood transfusion? And then Dr. Javed, welcome to the class, and then I'll discuss about like what are the protocol to start with massive blood transfusion and what are the complications of this blood transfusion. So what is massive blood transfusion? First of all, what is it? Okay, when do we say that the blood transfusion is massive? That is when the replacement of one entire blood volume, okay, replacement of one entire blood volume within 24 hours. Okay, if I am replacing one entire blood volume within 24 hours, that is actually around, it is transfusion of more than or equal to 10 RBC units. Okay, so one entire blood volume, it approximates to 10 RBC units, and if I am giving it within 24 hours, then it is known as the massive blood transfusion. ठीक है, या फिर within 1 hour, okay, in 1 hour I am transfusing more than 4 RBC. If I am transfusing more than 4 RBC units in 1 hour with anticipation of continued need for the blood product support. Okay, the transfusion of more than 4 units per hour with anticipation that I will need more blood support in the coming hours, or replacement of more than 50% of the total blood volume by the blood products within 3 hours. Okay, so if one entire blood volume within 24 hours, okay, या फिर which is nearly equal to 10 RBC units, okay, or within 1 hour I am transfusing more than 4 RBC units. Okay, so that is the definition. Then we say it as a massive blood transfusion. Now, what are the indications for this massive blood transfusion? Okay, not everyone get the need massive blood transfusion. So what are the indications? So basically there are no clear-cut indication. There is no clear-cut indication for massive blood transfusion, but it is based upon how is the physiological state of the patient. ठीक है, it depends upon how is the physiological state of the patient or how much evidence of the amount of the blood loss. तो पहले physiological state, like if the patient how much he is tachycardic or how much there is falls in the fall in the BP, depending on that we can decide, or evidence of amount of the blood loss or potential for ongoing hemorrhage. We are seeing that ongoing bleeding is there, so these might require the massive blood transfusion. Okay, Dr. Javed, is it clear? So I just discussed what is massive blood transfusion and when is it indicated. So basically there is no clear-cut indication, but depending upon the physiological state of the patient, depending upon how much is the amount of the blood loss, or if there is any potential for ongoing hemorrhage, then we might need massive blood transfusion. So what happens, okay, in massive hemorrhage? What happens during massive hemorrhage? What is the pathogenesis of hemostasis abnormality in massive hemorrhage? जब severe trauma होता है, Dr. Ragul, welcome to the class. Okay, if any doubts, please let me know. So whenever there is severe trauma, okay, whenever there is severe trauma, that will cause bleeding. ठीक है, because of the bleeding there might be tissue hypoxia, because the oxygen carrying capacity is also decreased. ब्लड लॉस हो रहा है तो ऑक्सीजन की कमी होगी, सो देयर विल बी टिश्यू हाइपोक्सिया. बिकॉज ऑफ द टिश्यू हाइपोक्सिया क्या होगा? एनारोबिक रेस्पिरेशन एंड देयर विल बी एसिडोसिस. Acidosis will also lead to coagulopathy. So severe trauma, bleeding is causing tissue hypoxia. Because of that there will be acidosis and that can lead to coagulopathy. Now whenever bleeding is there, हम लोग क्या करते हैं? We infuse the colloid and the crystalloid infusion. ठीक है, अब क्या होगा? The intravascular fluid, there will be dilution. ठीक है, कोलॉइड एंड इंट्राक्रिस्टलाइट इन्फ्यूजन, उसकी वजह से क्या होगा? डाइल्यूशन ऑफ coagulation factor and the platelets. And if this is not on the room temperature, अगर हम लोग उसको, so it might also lead to hypothermia. Or if I am giving massive RBC infusion also, these are at a lower temperature, so if I am giving it at a very large amount, that can lead to hypothermia. So basically the hemorrhage, the end point of hemorrhage is it can cause acidosis, ठीक है, which further worsens the coagulopathy and also hypothermia. Dr. Ragul, Dr. Javed, is it clear? So this is known as the lethal triad. Very important. What is the lethal triad? It is seen when there is hemorrhage. Okay, so because of the hemorrhage, I told you there will be tissue hypoxia, which will lead to acidosis. Because of acidosis, decreased heart performance, that can lead to hypothermia in turn will cause decreased coagulation से वजह से वापस से blood clotting problem can also coagulopathy, increased lactic acid in the blood. So this is a triad. Okay, this is the triad. One thing leads to the other thing leads to the third thing. So it is seen in case of the severe blood loss. Is it clear? So pathogenesis, what is lethal triad? Lethal triad is hypothermia, coagulopathy and acidosis. Now basically whenever there is massive hemorrhage or whenever there is hemorrhage, what is the goal of our care? हम लोगों को हमारा गोल क्या है? Whenever we see that there is bleeding, what is our goal of care? Our goal of care is first and the foremost, we have to control the bleeding. जहाँ से भी bleeding हो रही है, we have to control the bleeding, and then we have to give appropriate resuscitation. And this resuscitation ठीक है, ऐसा नहीं है कि हम लोग उसको कितना भी फ्लूइड देते हैं. द फ्लूइड शुड दैट शुड बी गिवन शुड बी appropriate, because if I am giving lots and lots of colloid or crystalloid, that can also cause complications. So it should always be appropriate resuscitation, that is, I should minimize the IV fluids, and as soon as the blood products are available, we should administer the blood products, and we should take care that there is no hypothermia and acidosis. We should avoid hypothermia and acidosis. Okay, so these are for the appropriate resuscitation. And to achieve this goal of care, that is to control breathing and appropriate resuscitation, we have to achieve this. That is, for that we implement the massive transfusion protocol, massive blood transfusion protocol. For that, we are implementing the MTP protocol. Is it clear? So, the goal. So, what is massive blood transfusion? वो बता दिया. Massive hemorrhage की वजह से क्या होता है? वो बता दिया. Indications, there are no certain indications. It depends upon the physiological state of the patient. ठीक है. Now, what are the criteria for activation? हर पेशेंट में जिसका RTA ट्रॉमा हो रहा है, उसके केसेस में तो हम लोग MTP एक्टिवेट नहीं करते. So there are certain criteria to activate the MTP. ठीक है, इसको समझो कि हर केस, जो भी ट्रॉमा का केस आ रहा है या फिर जो भी कॉम्प्लिकेटेड केस आ रहा है, उसमें हम लोग ऑनगोइंग ब्लीडिंग के साथ हो रहा है, सभी केसेस में MTP इज नॉट एक्टिवेटेड. देयर आर सर्टेन क्राइटेरिया विच अ क्लिनिशियन सी. ठीक है, एंड इफ दोज क्राइटेरिया आर मेट, वी हैव टू एक्टिवेट अ प्रोटोकॉल. ठीक है, we have to tell the blood bank, see, we have a case like this and we need to activate the MTP protocol. Okay, it's a sequence of events. So MTP is activated if actual or anticipated transfusion of 4 units of RBCs in less than or equal to 4 hours. So I told you, in less than or equal to 4 hours, you are saying that you have transfused 4 units of RBCs. Okay, then you should, and there is, after that also there is anticipation of ongoing losses, it's better you activate the MTP. Okay, or else within 3 hours you have lost 50% of the blood volume. ठीक है, तो क्राइटेरिया क्या क्या है? अगर 4 घंटे से कम में 4 यूनिट्स ब्लड आपको ट्रांसफ्यूज करने पड़ गए एंड यू आर एंटिसिपेटिंग दैट द ब्लड लॉस विल बी ऑनगोइंग. ठीक है, या फिर विद इन 3 hours 50% ऑफ द ब्लड वॉल्यूम इज लॉस्ट, और क्लिनिकल और लैब एविडेंस ऑफ कोगुलोपैथी or a clinical diagnosis associated with coagulopathy. ठीक है, clinical or lab evidence of coagulopathy or a clinical diagnosis associated with coagulopathy. So these are the criteria for the activation of the MTP. ठीक है, when we are seeing that there is associated coagulopathy, in that cases also we have to activate the MTP. Okay, so MTP, as I told you, what are the steps? The senior consultant, always remember, it is the senior consultant which determines whether the patient needs MTP or not. ठीक है, and if it is needed, पहले ही the patient details are shared with the blood bank and they will notify them. Blood bank क्या करेगा? वो MTP pack, and this is important, MTP pack, the components of the MTP pack. Okay, the components of the MTP pack are 4 units of PRBCs plus 4 units of FFP and 1 bag of pooled platelet. Is it clear? Dr. Javed, Dr. Ragul, is it clear? So what does the MTP pack contain? MTP pack contains 4 units of PRBCs, 4 units of FFP and 1 pooled platelets. That is the MTP pack. ठीक है, and cryoprecipitate is used only if the fibrinogen level is less than 1 gram per deciliter. Then the MTP pack will also contain the cryoprecipitate. And these 3 things 4 units RBC, FFP and 1 unit of pooled platelets are transfused in a ratio of 1:1:1. ठीक है, अब इतना हम लोगों ने ट्रांसफ्यूज किया, देखा कि हीमोस्टेसिस हुआ है और रेजोल्यूशन ऑफ कोगुलोपैथी हुई है कि नहीं. अगर हुआ है, स्टॉप द एमटीपी एंड नोटिफाई द ब्लड बैंक एंड always return the any unused blood as soon as possible. But if you see that hemostasis has not occurred or there is no resolution of coagulopathy, notify the blood bank that you need another MTP back because you are needing this much, itni jaldi se, and this much amount of blood. So you should always be in contact with the blood bank. You should always be in contact with the blood bank. Am I clear? Am I clear? Any doubts? Dr. Javed, Dr. Ragul, any doubts? This is very important topic. Till now, the questions have been asked from the complications of MTP. So in the further years, they can ask us about MTP, the definition of MTP. Okay? The definition, as I told you, that within 24 hours 1 unit full blood volume is replaced, or that is around 10 RBC units. Okay? Or within 3 hours 50% of the blood loss is lost. Okay? And what are the components of the MTP pack? That are 4 RBCs, 4 FFP and 1 platelet. And these are to be transfused in a ratio of 1:1:1. Okay, so these are the components of MTP. The first is the PRBC. In this we have to see that it is matched. Okay, ABO and RH compatibility is present or not. Okay, and then PRBC, okay, it is obtained from, okay, PRBC, plasma and platelets. These are obtained from the whole blood. Whole blood को centrifuge करोगे तो सबसे नीचे will be the PRBC, सबसे नीचे will be the PRBCs. Then just above it we will have the buffy coat, ठीक है, which is having the WBCs, and above that we will have a platelet rich plasma. ठीक है. एंड देन दिस, ये जो प्लेटलेट रिच प्लाज्मा है, इसको हम लोग सेपरेट करके फर्दर सेंट्रीफ्यूज करेंगे. देन वी विल गेट द प्लेटलेट अलग से एंड द प्लाज्मा प्लेटलेट पुअर प्लाज्मा, and from that we will get the FFP. From that, when we are freezing that platelet poor plasma, we get the FFP. ठीक है. So it is obtained from the whole blood when it is centrifuged. See, stored at PRBC. कौन से टेम्परेचर पे स्टोर्ड होता है? PRBC is stored at 2 to 8 degrees Celsius. ठीक है, 2 to 8 degrees Celsius, and the lifespan depending upon the preservative. If it is CDPA, then it is 35 days, and if it is a SAGM, then it is 42 days. ठीक है, and it should be used within. Okay, whenever we are getting the PRBC, start within 30 minutes and complete the transfusion within 4 hours. Okay, it should be given within 4 hours. Okay, and the uses for the volume expansion to control, okay, for the volume expansion. So that is the PRBC. ऐसे FFP हम लोगों ने बताया, प्लेटलेट रिच प्लाज्मा को सेंट्रीफ्यूज करोगे, उसमें से हम लोगों को प्लेटलेट और प्लाज्मा अलग से मिलेगा. When the plasma it is freezed, then we get the FFP, and FFP it is stored at -26 degrees Celsius or lower, and we can use this till 1 year. We can use this till 1 year. And whenever we receive the FFP, we should use it immediately or within 6 hours. Within 6 hours you should use it. Is it clear? Is it clear? I've already discussed this in the previous classes. Is it clear? Any doubt? Dr. Javed, Dr. Siva. So PRBC, ठीक है, it is obtained from the whole blood centrifugation, stored at 2 to 8 degrees Celsius. I told you lifespan, okay, depending upon the preservative, and it should be used within 30 minutes as soon we get, and it should be completed within 4 hours. And uses for the volume expansion, FFP for the coagulation disorders, and platelets. Platelets, these are stored at, okay, so platelets अगर पूछा जाए तो it is stored at 22 degrees Celsius plus minus 2 degrees Celsius, that is at the room temperature. ठीक है, and you should use it as soon as they are available. ठीक है, as soon as they are available. ठीक है, और इसका लाइफ स्पैन है 3 to 5 days. इसका लाइफ स्पैन है 3 to 5 days. और यूजेस फॉर प्लेटलेट्स, ठीक है, एंड यूजेस, इट इज यूज्ड इन केसेस व्हेनेवर देयर इज प्लेटलेट डेफिशिएंसी. ठीक है, प्लेटलेट डिसऑर्डर. सो दीज आर द components of the MTP. These are the components of MTP. Is it clear? Is it clear? Now you will ask me why in MTP there is just bleed loss, why we are giving FFP and platelets also. See, because I'm losing so much blood, okay, losing so much blood, there will be dilutional coagulopathy also, therefore I have to give FFP. And in the stored blood, the platelet count is decreased, and therefore I have to give the platelets also, and therefore we have to replace the platelets also. Is it clear? Is it clear? So these are the components of FFP. Now, guys, any doubt? So coming to the very important point, what are the complications? Okay, complications of the massive transfusion. इतना ज़्यादा ब्लड हम लोग रिप्लेस कर रहे हैं, so there will be some complications. So these complications are in turn divided into the immediate complications and the delayed complications. In the immediate complications, we will see, because of the problems which are arising secondary to volume resuscitation. Okay, the problems which are arising secondary to volume resuscitation, for example, if the resuscitation is not proper, if it is inadequate, तो inadequate resuscitation में क्या होगा? हाइपोवोलीमिया, ठीक है, हाइपोवोलीमिया होगा, एसिडोसिस हो सकता है, ठीक है. सो हाइपोवोलीमिया, एसिडोसिस. ओवरजीलस, अगर हम लोगों ने बहुत ज़्यादा उसको फ्लूइड या ब्लड दे दिया तो उसकी वजह से क्या होगा? सर्कुलेटरी ओवरलोड. there will be circulatory overload, and that is known as transfusion associated circulatory overload. That is known as transfusion associated circulatory overload. And yesterday I discussed with you, this is mostly seen within 6 hours of the plant transfusion at patient, because there is circulatory overload. The patient will have dyspnea, okay, hypoxia, wide pulse pressure, okay, raised JVP. So all these features will be seen in cases of transfusion associated circulatory overload. So these are because of the volume resuscitation. अगर बहुत कम है, there can be hypoxia and acidosis. If overzealous, बहुत ज़्यादा दे दिया, so that will cause transfusion associated circulatory overload, which is known as TACO. Is it clear? Now, because of the transfusion, there can be dilutional problems also, and that's why I told you in MTP we are not just giving the RBCs, packed RBCs, we are also giving the FFP and the platelets. So dilutional coagulopathy can happen whenever there is hemorrhagic shock. Because of the bleeding, hemorrhagic shock, what will happen? There will be the shift of fluid from the interstitium into the intravascular compartment, and whenever there will be shift of fluid from the interstitium into the intravascular compartment, तो क्या होगा? There will be dilution of these coagulation factors, and that will cause what is known as dilutional coagulopathy. That will cause what is known as dilutional coagulopathy. Is it clear? So these are the dilutional problems which we will see, and because we are giving large amount of the stored blood, because we are giving large volume of the stored blood, because of that also we have complications, and many questions have been asked from this. See, stored blood, okay, what is the additive to increase the shelf life? That is CDPA, that is citrate, dextrose, phosphate and adenosine. अब ये जो citrate है, it is an anticoagulant, but it also chelates calcium. ठीक है, and as it chelates calcium, it can cause hypocalcemia. See, normally क्या होता है? The citrate, it is metabolized by our body. But when we are giving a very large amount of the blood, the body is not able to metabolize the citrate, and therefore there will be citrate toxicity. So whenever the citrate level increases, what will happen? It chelates the calcium, and therefore it causes hypocalcemia. And this citrate, when the body is not able to metabolize it, what happens? Liver में it is metabolized to bicarbonate, and therefore it can cause metabolic alkalosis, and which will in turn lead to decrease in the potassium level, and therefore we will have hypokalemia also. And question has been asked on this in the previous AIIMS exam. ठीक है, हाइपोकैल्सीमिया हो सकता है, मेटाबॉलिक अल्कलोसिस हो सकता है. सिट्रेट, इट ऑल्सो binds to magnesium, and therefore it causes hypomagnesemia. So these are the problems which happens because of the citrate, increased level of citrate, which is seen in cases of the massive blood transfusion when the body is not able to metabolize the citrate. ठीक है. Then hyperkalemia can also be seen. That is because when the transfusion rate exceeds 100 to 150 ml per minute, transient hyperkalemia is seen. ठीक है, hyperkalemia, it can occur because of the lysis of stored RBC. उसकी वजह से क्या होगा? There will be hyperkalemia, or if there is hypoperfusion will lead to acidosis, which will aggravate the hyperkalemic condition. It will aggravate the hyperkalemia. Now, this hyperkalemia, okay, the cardiac effects of hyperkalemia, it is accentuated by हाइपोकैल्सीमिया, तो बहुत ज़्यादा ड्रेडफुल कॉम्बिनेशन है, दैट इज हाइपरकैलेमिया विद हाइपोकैल्सीमिया. द कार्डियक इफेक्ट्स विल बी एक्सेंचुएटेड, and to prevent this what we can do, we should use the freshest blood available in the blood bank and less than 7 days to be used. ठीक है, in the blood bank freshest blood और less than 7 days का blood है that can be used to prevent this hyperkalemia, Is it clear? Now coming to acidosis, it can also cause acidosis. I told you it is more because of the hemorrhage or hypoperfusion that the body is having acidosis. ठीक है, so it is mainly because of inadequate treatment by hypovolemia. ठीक है, and because of acidosis what happens, it is causing coagulopathy. How? Because it reduces activity of both extrinsic and intrinsic coagulation pathway, because it is reducing the activity of both extrinsic and intrinsic coagulation pathway, and therefore it can in turn lead to coagulopathy, so lethal trial. ठीक है, now hypothermia, ये जो stored blood है, it is stored at a temperature of 2 to 8 degrees Celsius. ठीक है, जब हम लोग massive दे रहे हैं, we don't have that much time to bring it to the room temperature. ठीक है, so platelets, there is depletion of the platelets. The platelet function, it decreases within 24 hours of storing the blood. ठीक है, तो therefore there is depletion of the platelets, and also there can be micro aggregation grades can be formed in the stored blood. ठीक है, in the stored blood micro aggregates can be formed because of the platelets and the WBC, and these micro aggregates, they can embolize to the lung, and if they do, they can cause ARDS like features. So these are the complications of the massive blood transfusion. ठीक है, या तो ट्रांसफ्यूजन कम है उसकी वजह से हाइपोपरफ्यूजन, या फिर ओवरजीलस है उसकी वजह से, बिकॉज ऑफ द स्टोरिंग, बिकॉज ऑफ द सिट्रेट विच इज प्रेजेंट, दैट इज, एंड बिकॉज ऑफ द स्टोरेज, हाइपरकैलेमिया, depletion of the clotting factors, and the platelets can be seen. ठीक है, so these are the complications which have been asked previously in your exam, and also the dilutional properties. ठीक है, okay, now that were the immediate complications. Delayed complications, it can be respiratory failure, ठीक है, या फिर transfusion related acute lung injury. These are because in the donor, ठीक है, in the donor plasma there is presence of anti-HLA or anti-granulocyte antibodies. ठीक है, and these, they cause activation of the leukocytes. ठीक है, leukocytes which causes acute lung injury, and therefore the patient can have TRALI. ठीक है, it is one of the complications of the blood transfusion. ठीक है, sepsis if it is contaminated, or there can be thrombotic complications also. So these are the delayed complications. So in this class, the important points, okay, the important points from which the questions can be asked is what is ठीक है, massive transfusion. ठीक है, what are the components of, ठीक है, of massive transfusion protocol, that is 4 PRBCs, 4 FFP, and 1 unit of platelets. Okay, and third, very important, the complications of massive blood transfusion. Okay, so these are the important points, and many questions have been asked from this, that is the complications of massive blood transfusion. In fact, last year this year AIIMS 2020 questions were asked from the complications of the massive blood transfusion. Is it clear? Any doubts? Any doubts? So friends, that was all for today's class. And on the Telegram app, we have a channel, t.me or NEET PG Live. On this, we are daily posting when will be the scheduled class and what will be the topic of the class. And to get the Unacademy Plus subscription, the advantages I told you in the starting of the class. So to get the Unacademy Plus subscription, please install the Unacademy Learning app and select the NEET PG and get the Plus subscription. And if you are getting the Plus subscription and if you apply my code, that is Apoorva Live, APOORVA Live, you can get 10% discount on the subscription. And on the YouTube, we have a channel, NEET PG. Okay, on the NEET PG, Unacademy NEET PG, please click the bell icon, subscribe it, like and share, and use my code, referral code, that is Apoorva Live, to get 10% discount on your Unacademy Plus subscription. Is it clear? Any doubts? A massive blood transfusion is also a very important topic. Okay, and I think the question will be asked from the protocol or the components of the massive blood transfusion. Okay, so that was all for today's class.